I'm Rafael Rivera. I'm the Associate Dean for Admissions and Financial Aid, and I'm happy to welcome you all to our second webinar for this season. Today is a very important topic. It's what we do to ensure the wellness of our medical students. And so for that, I'm going to pass the baton over to Dr. Linda Tewksbury, who is a pediatrician and is our Associate Dean for Student Affairs. She'll talk more about what we do for our medical students in this regard, and she'll present her team to you right now. So Dr. Tewksbury.
Hi, everybody. Again, my name is Linda Tewksbury, and I'm the Associate Dean for Student Affairs, and I'm happy to be giving this webinar for you on wellness for medical students at NYU Medical School. We have a team here that you'll get to meet in a minute. I have Annie Robinson, who is our wellness coordinator, of course, UME and GME, wellness facilitator, and then we have one of our MD PhD students, Camilla Delgado, and you'll get to meet them in a minute. So wellness is really a hot topic in medical education, and as you probably heard, because we know of the high rates of burnout and anxiety and depression in medical school. So this is something that we take very seriously at NYU, and we've been really working hard to support our students' wellness. So let's start off with what encompasses wellness. Wellness means a lot of different things to different people. And this is a very, many of you may have seen this wellness wheel. And I think it's a good reminder because some of us think about wellness just being physical fitness, but there's a lot of aspects to general wellness. So there's emotional wellness, spiritual wellness, social wellness, financial wellness. So I think it's important just to step back and think of the big picture of wellness. But wellness for medical students, I think there are specific ways that we can support our medical students around their well-being. And we've been thinking a lot about this here at NYU Medical School. And what we've tried to do is really take a big picture approach. And what I like to think about is the concept of we're helping our students develop a healthy professional identity. And there are a lot of things that aspects of creating this and supporting a healthy professional identity. And so for example, one example is confidence. When our students are not feeling confident, that can be a stress and that can impact students' well-being. A nurtured personal identity. Our students come from many different walks of life. They have different interests, and we found that nurturing their personal identity, whether it's an interest in the humanities or an interest in global health, can really help support our students' well-being. So this is just a whole host of things that we do to support these different aspects of well-being. And for the purpose of this webinar, we're going to focus on a couple of things that we do for our medical students that there is a particularly specific emphasis around wellness. So the first thing that I'm going to share with you is a new curriculum that we put in place starting last year, MD Aware, which is medical students developing awareness, well-being, and resilience. And as you can see on the slide, MD Aware really gets at three of these aspects of healthy professional identity. One, a very important aspect is creating a supporting and trusting community. Another aspect is helping our students develop personal resilience. And a third aspect is opportunities for reflective practice. So these are three important components of developing healthy professional identity and supporting well-being. And with that, I'm going to introduce Annie Robinson, and she is really the co-director of this program with me and has been a tremendous resource in developing this program.
Thank you, Linda. Hello, everyone. I'm Annie Robinson, and my role here at NYU is both working with medical students as well as with house staff and faculty to ensure well-being across the spectrum of training and practice. And so this program, MD Aware, is the goals that we have for it is to understand, it's both educational in that we try to help students understand the relationships between what it means to be aware how that impacts our well-being, our capacity to be resilient, thrive despite the challenges that come our way, and understand what burnout is, what the signs are, what the impact is, and how to look for that. So recognizing signs of stress and how to respond with healthy coping tools. So in this curriculum, we offer a number of different coping tools, understanding that not everything is right for everyone. And so we offer a whole menu for people to see what resonates with them. And we have really done due diligence in researching and deeply considering what the most evidence-based techniques are right now that we know promote resilience in one way or another. We talk about how these resilient skills that we're cultivating during your training are going to be integral to how you practice when you're a physician. And then another goal of MD Aware is to foster really strong connections among students, that is a really integral part of it. We know that social connection is a key piece to people feeling well, physically, mentally, emotionally. And so the way that this curriculum has broken down is that we developed our own well-being self-assessments that we send out to students to do every couple of months. It's always available if ever they want to take it, and it's just for them, so it's completely confidential. It's for them to check in with where they're at, how their resilience is, how they're eating, sleeping, moving, taking care of themselves in the physical plane, and then also what degree of exhaustion they're feeling emotionally. So we adapted 3 different scales to medical student experience. So each of these sessions, we do 6 of them over the course of 3 years. 4th years don't have one because everybody is dispersed. But for those first 3 years, we have 6 different sessions, and they always begin with a didactic portion where we present a topic. So for instance, coping with difficult emotions. And we'll do a 15-minute overview of some of the research behind the tool that we're going to teach to cope with that theme. Then we break out into small groups of approximately 10 medical students and a facilitator who's not somebody who's going to be evaluating those students in any way, so sort of a neutral facilitator who's been trained in this curriculum, facilitates an exercise. It could be a writing exercise, a conversation, different kinds of skills, techniques, tools, practices. Then we also offer and have collected a number of different support resources for students to access between sessions, which we are calling touchstones. So the way that it breaks down over these years is we have the first, during orientation week, the first session, we meet again with the first year medical students in November, so several months into their time here, and then again in February. And then during their second year, we meet with students right before they start clerkships in December, and then 3 months into their clerkships. And then during the third year, we meet with them when they're about 9 months into clerkships, so nearing the end. And so now Linda's going to take back over for a moment.
Back over for a moment. Okay, so I'm back again. So another really important committee that we have at our medical school is our wellness committee. So this is a student-driven committee. So where students got together and thought about how can students how can we support each other around wellness. And it's always great to involve students because students know what they need. And so we pay a lot of attention to the students, and we support this. This is a committee that's supported through the Office of Student Affairs. And our wellness committee is comprised of students across all the years. And to tell you a little bit more, and as you can see on this slide, I think the 2 aspects that the wellness committee really support is the personal resilience piece and the supporting and trusting community. And to tell you a little bit more about our wellness committee, I'm going to call up Sarah Keltz, who is one of our second-year students.
Hi, everyone. As Dean Tewksbury said, my name is Sarah Keltz, and I'm a second-year medical student here at NYU. And I'm going to talk a little bit about the Wellness Committee. I'm one of a number of different student members of the Student Wellness Committee. And our group is really, thank you. Our group is all about supporting student wellness in all of its different facets. So that's emotional health, physical health, mental well-being. It really runs the gamut. And we do that a number of different ways. So one area we really put attention into is throwing events. And those events can be geared towards physical health. For example, we have learning to lift events at various gyms. We'll have yoga classes. We have student-run HIIT interval training and some other student-run physical exercise events going on right now. We'll also throw events geared towards emotional well-being and even like building community around that. So we have a Finding Meaning in Medicine monthly seminar where students can come together in a faculty-free space and just talk about what's going on for them in their lives. And since we share a lot of similar challenges, since we're on this same path, it's an opportunity for students to also both validate and hear each other out, but also sometimes there's a space for kind of recognizing that a lot of us are going through the same things and finding support in that. And then in addition to throwing one-off events, we have a semesterly wellness fair, which is a really big event that provides a lot of access for students to access resources all in the community through really awesome raffle prizes, to local gyms, local massages, local healthy food places, and a strong advocacy branch as well. So advocacy is all about working super closely with the Office of Student Affairs. And the Office of Student Affairs supports us to sort of think about long-term how we want to make sure that student wellness is really being supported in all facets. And they also help us support our events. So you do get a great opportunity to work closely with the Office of Student Affairs through the Wellness Committee. And so I am going to go ahead and introduce Camilla, and another student is going to come talk about a specific program we have that is related to the Wellness Committee.
All right. Hi, everyone. So like Sarah said, I'm Camila. I am a 7th year MD PhD student. So as you can tell, we have people from all years, including MD PhDs that are part of the Student Wellness Committee. And one event that I just wanted to talk about that we recently started is called Resilience Rounds. And what's special about this event is that people from all different levels of training, so medical students, residents, fellows, attendings, and staff, so anybody that wants to come to this event can come, and we can come together as a community. And what Resilience Round does is that it offers a space for everybody to foster connection through telling and receiving stories about thriving despite the challenges. So we know that one of the most important things to battle burnout is a sense of community. So we really want to incorporate everybody throughout the different levels of training to come together and share what they're going through and find support through that. And we are starting to have this at least twice a semester now, and it's been really successful so far. So we are really pushing to have more of these types of events. And I am going to bring it back to Tewksbury.
Okay, so so clearly another really important part of supporting our medical students' well-being is to provide robust healthcare, and both medical healthcare as well as mental health well-care. And we do that through our student health services. So our student health services is conveniently located directly across the street from one of the main residence halls. And that's important because there's not a lot of time during medical school, and we want to make sure that there's easy and available access to our students when they need both medical care and as well as mental health services. I am very, very excited that we recently got funding for a full-time psychologist who's going to be available at Student Health for drop-in hours and to provide therapy to our students. This is starting in the fall. And that is going to be on top of the psychiatric services that we have had in place for the last couple of years. We actually have a psychiatrist on site a couple hours a day, 5 days a week. So there's also the opportunity for care with a psychiatrist And we're also offering now weekend mental health services that are available at a nearby auxiliary location. So this is, I think, really, really important that we're trying to destigmatize mental health and trying to talk to our students and saying that this may happen. And if it does happen, if you're feeling anxious or depressed or whatever's going on, there are services available, and we try to make it really easy to get in, get an appointment within a week or sooner if need be, and really provide acute care and have multiple visits over time until we kind of address the acute issue. And certainly for students who need more longer term care, we have a coordinator who helps find either therapists or psychiatrists in the area who can follow the students and take care of the students for longer periods of time. So this is a really important part, I think, of supporting well-being. And then the last program I wanted to share this afternoon with you is our Viola Society program. So this is our career mentoring and career program, but it really gets out of 3 of these bubbles here on our little conceptual model. So it's key in supporting a trusting community, which I'm learning is one of the best ways we can support our students' well-being is by supporting that and creating opportunities for students to develop these trusting communities. Personal resilience, but also confidence, because as you'll see, we have faculty advisors as part of this who serve as academic advisors to help students develop their clinical skills and guide them in their career. So the mission of the Viola Society program is to provide student-centered, academic, career-oriented, personal and community support throughout medical school. So all of our students are assigned to one of our 4 societies, and within that society to a specific advisor right from day 1 of medical school. And that advisor stays with them throughout their time here in medical school. And the goals of the program, again, are to enhance professional development, support well-being and personal growth. So you can see that's a big part of it. Disseminate opportunities and provide guidance for career decisions, as well as, again, this fostering a supportive community across classes and pathways. And I think I've mentioned a lot of these, and here's some fun pictures from some of our events from Viola Society. But again, that one-on-one advisor from a trained faculty, I think, is really, really important in helping our students feeling confident about their competence, and also in guiding them along their career path, because when you don't know what you want to do, that can certainly be a source of stress. So the faculty advisors are really good at dealing with that. Peer mentoring. We have peer mentors that apply for these positions. We have 2 peer mentors per faculty advisor, total of 12 faculty advisors, and the peer mentors meet with students across the 4 years and organize events, interclass events. We have a number of community building activities. 2 years ago, we went to Chelsea Piers, and this is a picture from Chelsea Piers. More recently, we went to Spin. You can see here to the right, these are 2 of our peer advisors at our recent Spin events, which again was a friendly competition to get students together and again do that community building. And then we also do some information sharing, again preparing students for the next step in medical school and guiding them in their career decisions. So that's it for our presentation, and we'd like to open it up for questions at this point in time.
All right, so we just come on over here. Let's see. Okay, so it should be these guys at the bottom. Okay, so yeah, now is the Q&A portion of the talk. So I would ask that if anyone has any questions from any of the speakers that you heard from today, then just, please type it into the question box and we'll answer any and all questions that come our way. So we've got the first one, which is, how is this wellness program implemented for students in the 3-year MD program?
So our students in the 3-year pathway program really are in school side by side with the students of the traditional 4-year program. So our MD aware curriculum includes both the 3-year and the 4-year pathway students. So we at the medical school are really trying to support wellness for all of our students. As you've heard, MD, PhD students included, 3-year pathway students, 4-year pathway students, dual degree programs. So these activities that we've discussed are open to all of those students. In addition, just because while it's great for the 3-year pathway students that they, once they get accepted, that they have an additional mentor and a guaranteed acceptance in one of our residency programs, it can also be a stressful time for them, especially at the end. They have a very condensed schedule. So in addition, the 3-year pathway students have an additional advisor actually on top of the Viola Society advisors to give them additional support in planning the unique aspects of their curriculum. More questions?
All right, you know what I'm gonna do is I'm gonna ask the entire team to come back here so that everybody can be on camera. I see we've got another couple questions that came up. And this next question is from somebody I met at one of our campus visits. Nice to hear from you again. So hello and thank you for the great presentation today. Can you speak to student feedback on the questionnaires they fill out every couple of months? If it is only for them to review, are students reporting that reflecting on their mental status has been helpful?
All right, so the self-assessments that we've created for our students, I will tell you that these are anonymous surveys. We send it out, but the students complete this, and we at the medical school have no access to the data. It's just for the students. We can look at aggregate data, but we can't look at individual data. And the reason, again, we want to, we want this to be just for the students. I think our concern was that if the students thought a faculty was looking at their results, they may not be so honest. And so we wanted to take that away and say, these surveys are just for you. We're actually going to start trying to roll them out every month, and we give students an opportunity to track the results over time. So this is like, where am I now? And what maybe I need to work on. Again, we as a faculty will be looking at results across the class, and we're just starting to collect this data. And obviously, we will try to think if we see problems across the class, we will certainly use that information and try to hopefully supplement the program.
Can you guys talk about the student advisory?
Yeah. Oh, yeah. Please. Yeah.
Oh, just that another form of feedback that we have in place for like the MD Aware curriculum is the student advisory board, which is a group of interested students who can get together and sort of report back on how the class is responding to the MD Aware curriculum, as well as sort of brainstorm new avenues, new directions to take it in. And so while that isn't like a data-driven feedback form, that is an avenue for thinking about how are people using these tools, and is it working for them?
Yeah. So I think that's great. I was thinking about the feedback from the tools themselves, but NYU is big on feedback. We solicit feedback from every course all the time, right, guys? Like I feel like we're constantly serving them. So very early on, I just want to reiterate that when Annie and I put this curriculum together, we did have some input from students, but we decided that it would be really good to have regular input. So we created this MD Aware Advisory Committee. We opened it up to all students. We have students across all 4 years. We meet monthly, and I can tell you, they are amazing. They've given incredible feedback to the curriculum. We actually did tweak our self-assessments based on their input. We have been, what we do now is review every session with them before we put it on and get their input. And it's just really incredible to partner with the students because this curriculum is for them. So it's really nice to have, and we absolutely value and act upon their input for sure.
All right. So the next one asks, thank you so much for taking mental health issues into account. This is definitely why I chose to apply to NYU, and I'm not saying that was actually in the question. The students and staff truly recognize a lot of the problems students face and acknowledges its normality. It is supportive to everybody. Thank you. Okay, so the next one is, I'm a bit confused about the Viola Society advisors. Does every student have a peer advisor and a faculty advisor?
Yeah, sorry, that wasn't clear. So we have 12 Viola Society advisors, and they are across all different disciplines. So each of the students are assigned to one of the 12 faculty advisors right from day one, and they're randomly assigned, and that's your advisor. Each faculty advisor has 2 peer mentors. So remember, the faculty advisors now have students from each of the years that are kind of in under them. And what we do is we have 2 peer advisors, and we break all of those students into 2 what we call families. And so there are 2 peer mentors per Viola Society advisor, and they organize activities for the families. Did you guys want to add to that at all? Yeah.
Yeah, I think it was clear, but we all have a peer mentor and a faculty advisor, which is great because sometimes you might want to go to them for like different concerns. Having a peer mentor who's really well versed with being a medical student, and having an advisor who has a more sort of broad view of the career as a whole.
And the peer
really
mentor
helpful.
is a 4th year. Yeah, it's a 4th year, or it could be someone who's doing a research year. And while we do, so I said each faculty has 2 peer advisors, and so all the students that are in that faculty's Viola Society are assigned to one of the 2. But the truth is, the peer mentors are used across. They do. They make themselves accessible to students even who aren't in their society. So they're a great resource. So let's say you're interested in plastic surgery and your peer advisor is going into pediatrics. Well, they can connect you with another peer advisor who's going into that specialty. So we really try to do this kind of cross-fertilization with that program.
And just to reinforce how important student feedback is, the entire Viola Society concept actually originated with one of our students, right, who came to Dr. Buck-Keltz a couple years ago, and to myself, and had this brilliant idea on the Viola Society mentor, and it was so great that we just implemented it within a year. So student feedback matters tremendously. Next question is, first, thank you for the presentation. Thank you, you're welcome. If possible, can I please hear from one of the students how they balance research, academics, and community service? How did they go about figuring a work balance experience? That's a question that applies to everyone. But,
Maybe because I
there you go.
so much time off. I think it took a little bit for me to find how to balance. Once you get into medical school, it can be a little overwhelming just to find a new normal. Well, when it comes to the MD PhD, you have dedicated time for medical school and then dedicated time for research. I think you can do both at the same time, just because it requires your full attention to do that. But I think over time I realized that if I didn't try to establish a balance for me, I wasn't going to be happy and successful. So you just have to work hard, but at the same time put your mental health, your emotional health, and all of that first. So I work a lot in the lab right now trying to finish up my last year, but I always have time to be part of these advisory committees and be involved with the student wellness health and be involved in all of that, as well as doing community service with the grad school program and having time for me and, going to the gym and having time for family and friends. And it just takes some time for you to understand, prioritize and kind of set aside time for your own mental and emotional health. So it just takes a little bit of time for you to find it, but once you find your rhythm, I think we all understand that all of these things are also important, and we all manage to kind of find a nice rhythm in incorporating all these things. So.
And maybe Sarah, it'd be good for you to contribute to as a second-year student. Maybe you can speak specifically first year and how you navigated
the preclinical curriculum. Yeah, so I'm still in the preclinical part of the curriculum. And I would say I certainly have classmates who, during this period of time are balancing research, school, community service, and their personal lives. However, I don't think you need to be balancing that. And I would say for me personally, I am someone who likes to have a lot of personal time, downtime to recharge, exercise, and a lot of sleep. And so The way I've kind of found med school to be is that in different sort of parts of the four-year curriculum, you can really focus on different aspects of that. So I'm not doing much research right now, and I'm really focused on school and taking care of myself and my personal life and my social life. And I have some extracurricular involvement as well, but I don't have like a major research involvement or a really major community service involvement that's sort of on par with school. Whereas, you know, in college, like I may have been juggling that. I find that school really is the main priority for me right now. And so the four-year curriculum, at least it seems to me that there is sort of opportunity at different stages in those 4 years to focus in on different things. So there are times where school winds down, especially later in medical school, and there's even open time specific for research pursuits, or time, let's say over the summer between first and second year, where you can really hone in on like a community service project you're passionate about or a research project you're passionate about.
Yeah, why don't you say what you did?
Yeah, so I did some research over the summer looking into psychiatrists' attitudes towards patients who have antisocial personality disorder. So trying to understand, one, like whether psychiatrists are on the same page about what the disorder even is, but then also how they feel about working with those patients and some of the challenges of working with those patients or possible stigma that's attached to a patient having that diagnosis. And so it was really great to have time away from school to follow a little passion project and just read what I was passionate about and interview a bunch of psychiatrists and get to know a lot of the sort of psychiatric community at NYU. So that being said, you don't have to be sort of juggling all those three things simultaneously. You can find different parts of your training to bring different things to the forefront.
Yeah.
And nobody will push you
Yeah.
to try to do all these things at the same time.
Yeah, I think that's good advice. I mean, we see all your applications and we know how much you juggle in undergrad, but you just don't have to do. You don't have to do everything. And there are times, as you can say, as you heard, Sarah was able to focus on school and then she had the summer to pursue research. You don't, and you heard from Camila that, you know, when I'm in the lab, I'm focusing on the lab. When I'm in school, I'm focusing on school. So there's no pressure that you have to do everything all the time. You can set priorities and there are spaces in the curriculum to focus on different things.
Yeah, I mean, I would echo that. Not only do you not have to, I think it's difficult for anybody to do everything. You have to first know yourself, know what it is that you value, and be able to prioritize those things that are important to you. All right, so the next question is, what level of involvement do faculty members have in these community building events? Could some of the students speak to relationships that they formed through these that they might not have otherwise? Thank you.
Which events, like, oh, just maybe the
Like
Viola Society.
Yeah.
Mhm.
Yeah, sure. So I think a lot of the sort of events that we've talked about give students a great chance to get to know faculty. So Viola Society events, well, for one, your Viola Society advisor is someone you're having continual contact with, both in one-on-ones, but also through these events and more social interactions. And that gives you a chance to really get to know them. You also get to meet various Viola Society advisors. So I know, Dean Tewksbury, you were talking about how it's not just your one advisor, but you kind of can take on like anyone in that community as a mentor. And I think one of the opportunities to do that is at Viola Society events where multiple advisors are present and involved, and you can just get to know them. I would also say that the resilience rounds that Camilla was talking about is a great opportunity to meet kind of role model or mentor physicians who are, you know, really comfortable being vulnerable about their training process.
And then the Office of Diversity Affairs.
Yeah, that's another big one.
Also has a list of faculty depending on, I mean, do you want to talk about? I'm not.
Yeah, you can talk
Oh,
about it,
okay.
yeah.
I think they have a list of faculty that, let's say, identifies as LGBT, and then if there are students that are particularly interested in finding a mentor, they can go to the Office of Diversity Affairs, or I'm not sure what else. I know there's a bunch of them.
URM faculty.
URM
like
faculty.
I'm meeting with my group tonight for the diversity initiative,
Yeah.
going out to dinner as a group. Yeah.
Exactly. So you can find mentors in all these different types of areas that you might be interested in.
So we do an all-school event in the fall. That's what we've been doing, and then in this winter we do society events. So you can meet again faculty from other groups as well. We do wellness events in the spring as well, and then the faculty. So the faculty do, as you heard, they have one-on-one sessions with their students. They have small group meetings with just the class. At least once a semester, and then they have with all of their students across the classes at least once a semester. And some of the fun things that they'll do, I know in last spring they went out painting. A couple of groups went to the museums. A couple of groups did the escape the room. So they'll do these kind of community events with students across all 4 years. And it is I guess I should speak. I'll let you guys speak, but it's a nice informal way to kind of get to know your faculty in those kind of settings.
Any other faculty that I know did that escape the room thing?
I didn't do it, but I know 2 of the groups did it, and they had a lot of fun with it.
That sounds like fun.
Yeah.
Okay, so the next question is, thank you for holding this session. I wanted to ask about options for students who suffer from acute trauma / psychiatric hospitalization / chronic mental illness. What are the options for time off? Has there ever been an instance where a student is too unwell to receive a degree?
So I always tell your health comes first. The most important thing is taking care of your health. We have students, we'll have a number of students with chronic, both medical and mental health conditions. And if they are able to continue in the program, as they engage in care, they could stay in the program. If it gets to the point that it's too much to deal with a chronic illness and be in the curriculum, it's a conversation, and they can have a leave of absence, and they're welcome to come back after they get the care that they need. So it depends on the situation. Again, we have some students who are able to continue in the program with the support, and again, our student health services can provide that support. Usually, again, if someone does need long-term care, we do try to get them to an outside person. And then, as I said, sometimes there are some students who just need to take time off, and we support them and welcome them back after they've gotten the care that they needed.
Exactly.
We don't kick them out.
Next question. So second question from a former, somebody asked a prior question. Do you still have the yoga anatomy class? This individual remembers meeting Camilla there, she says.
Oh, yeah, hi. I think I remember you. We are planning on having another yoga anatomy session. That's when we linked. Usually we try to do it when students are taking the anatomy class, and we try to do a yoga session that tries to incorporate what you're learning in your anatomy class with yoga and kind of understanding your body, and like a refresher for the exam kind of, but also just a fun way to think about anatomy differently incorporated with a yoga class. So yes, we are planning on that.
Namaste, right? Okay, next one is, what is the amount of time between when a student requests access to mental health resources, advising, counseling, therapy, and when they gain access to them? Does this vary throughout the year?
Our goal, I think our goal is, if it's urgent, if someone needs urgent care that day, we'll get it to them that day, and I mean, where I walk students over to mental health, or I've gotten, but usually we try to get them in within a week. That's our goal, is to get somebody in within a week to see one of our mental health providers. And if it needs to be done before then, we try our best to make it happen.
How does a student get involved with the Wellness Committee? Can anyone join? And thank you for the wonderful presentation.
Anybody can. Well, we send out applications every year, and then we recruit people, and we always want people from different years and different ideas, and that want to be part of the different subcommittees that we have. So yes, anybody can apply and join to be part of the committee.
Okay. Can you switch mentors or advisors in case you feel that they are not appropriate for your needs?
We've never had to do that with the Viola Society. I mean, we tell you it's your advisor for your whole time here, and it doesn't matter if that person isn't in the specialty that you're going into. And I think we certainly, if a situation came up and there was a real conflict between an advisor and a student, I wouldn't have problem making a switch, but we have amazing advisors and we've never even gotten the request.
And then people just complement with other
Right.
advisors.
So that's the whole thing. You know, your Viola Society advisor is just one advisor. So all, in addition to your Viola Society advisors, when students are ready to commit to a particular specialty, and that happens particularly early for the 3-year pathway students, they get a departmental advisor. So they get an advisor in the department that they're applying to. And many of our students who do research, they have a research advisor. So the Viola Society is just one person. So the tendency is you add on from that. It's not like you don't switch your Viola Society. And I think most of our students wind up getting pretty attached to their Viola Society advisor.
So safe to say, no one advisor can do everything.
No,
You want an advisory
exactly.
team, if you
Yeah. You know, it's better to add on than to.
Okay. Hello, thank you for your time. Does the wellness program offer student gym memberships to help with physical health?
So NYU does have a corporate discount with some gyms. We have one really close that's called Crunch, which I am a member of, and I use that corporate discount. And then we also try to find discounts and student deals for different types of physical health types. So there's like yoga studios, that HIIT training, spinning.
Yeah, so we'll try to broadcast out if there are any studios or facilities that have student discounts. We'll also run events that are discounted with gyms sometimes that are kind of one-off events, in addition to student-run totally free events on campus that are physical fitness oriented. And then I would say the other opportunity is through the wellness fair, although that's a lottery and that's a raffle, that there are pretty good odds in the end, and we give out a lot of sort of 5-class pack or 10-class pack or 3-month membership to a gym and a training session, prizes like that allow students to at least for a time take advantage of really, really low prices for local gyms.
And just to add, Vilcek Hall, one of our main residence hall, has a gym. Pretty nice gym with and we just updated it, got some new equipment for there. And in the other main residence hall, we are going to be renovating a space that can be used as a flex space for yoga classes, bar classes, and stuff like that. So we do have some opportunities on campus as well.
And we have full access to the Palladium. So if there's anything, if you want to utilize, gym resources that aren't available in our residence hall, the undergrad NYU gym, which is, a really short commute away, maybe 15 minutes away, is like, has everything you can imagine.
And there's a free bus that takes you there, right?
Yeah, there's a free shuttle.
Or you could just walk it. It's a really short walk.
Okay. Another question for the MD Aware program. I am curious about what kind of evidence-based techniques you are teaching to promote resilience. Can you elaborate a bit, please?
Amy's gonna take
Sure.
this one.
All right.
Say something. So evidence-based, I think that the number one evidence-based tool that we go to a lot are different kinds of mindfulness practices, that there's increasing science out there on the impact for both mental and physical health. So I'll give an example. We have drawn a lot from Ron Epstein, is a physician at University of Rochester who has spent his career studying the impact of using mindfulness with physicians and how it improves quality of care, patient satisfaction, physician satisfaction, fewer medical errors, mitigate bias and prejudice, just by tuning into and developing this part of your brain that allows you to direct your focus and allows you to truly be present with the person before you, with the task before you. And so doing this kind of attention control so the goal is not just relaxation and calm, though that sometimes can happen, but it's about how to truly be present and strengthen that part of your brain. So strengthen that part of your cortex. So we go into the science of it. And I'd say that mindfulness is one of the biggies.
Yeah. We introduced a tool called 3 Good Things, which is a gratitude exercise that came out of the positive psychology literature, Mark Seligman and stuff. And there's really actually good evidence that this gratitude exercise can have an impact 6 months down the line, there's some science behind it.
So much sooner, 4 to
Yeah,
5 days
4 to 5
of doing this exercise.
I
And
love
all the
three good
clinical
things.
trials demonstrate that you start to sleep better, your mood improves.
Yeah.
After just 4 or 5 days of writing down 3 good things that have happened during that day.
Try it.
Gotta get it.
It's
Before
amazing.
you go to
Three
sleep,
things, look it up.
write down 3 things. Yeah, you can look it up. It's a great exercise.
That's awesome.
Yeah.
Thank you for the presentation and dedication to wellness / mental health. Are the services offered by the Student Health Services Center available to all students, or does this depend on your health insurance?
It's free for all students. Free for all students.
Thank you very much for the terrific presentation. For the medical students, which wellness resource has been most helpful for you? Is there a resource you wish were available?
Good question.
Yeah, very good questions.
I think the first service that I used was the mental health service in my first semester of medical school, just because it was overwhelming and I didn't know what was happening and I had a lot of anxiety. And I can speak to the fact that I got, it wasn't like an emergency, but I got to speak with somebody pretty soon, from what I remember. It was a while ago, and I continued to get the care that I needed. So that was definitely the biggest, and that I would say has had the biggest impact, because I think at least I struggled with, once you're here, to one, kind of accepting to yourself that you deserve to be here. I think we all have a little bit of that imposter syndrome. Very much so. And then kind of understanding that, and then in undergrad you're like doing all these things to try to get into medical school, and then you're here and you're like, okay, now what? And but then I got definitely the help that I needed, and so I would say that was the biggest. And then all of the student run events have also had a big impact on me. I got to keep doing yoga. I was doing yoga before I joined, and we had yoga classes, so I was able to continue to do that, and the different things. But I don't know if you want to add to that.
Yeah, well, I also would say that using the mental health, the counseling resources has been really helpful and useful for me, and I've had really great experiences using the mental health resources here. And then one other resource that I'd like to highlight is actually a wellness committee event, Finding Meaning in Medicine, which I had mentioned earlier. And for me personally, in addition to being involved in coordinating, it actually has been, I think, a really influential resource for me in terms of just transitioning into medical school and finding community here. I found that in my first semester of preclinical, it was kind of an intense transition, and it's a really fast pace of some material that was really brand new for me. So I got a little bit lost in that, and being able to have a monthly group with people from all 4 classes and sort of see broad view, what are the different challenges or really exciting successes that people are having at all different stages of medical school, gave me a great bird's eye view of okay, this is just one phase, it's going to keep changing, and there's no reason to be consumed by what medical school looks like this particular month in this particular class. It also was a great way for me to meet upperclassmen friends and mentors who have made a huge difference in terms of just giving me perspective, advice, and being great friends who are at different stages of medical school.
And anything you wish we had, I think was the second part.
Right. Oh, I think we wish we had. Honestly, there's too much. There's so much available. I don't know. I don't think so.
Yeah, I mean, I don't know. The only thing that comes to mind is when people asked about gym memberships, I would totally utilize more gym memberships, but there's nothing that I've thought of doing in the past. Yeah.
Do we have US New York sports too? I remember students used to have access to New York sports.
Maybe.
They're a little bit further up though.
I
know.
Yeah. I know French just because it's the one I use. But
And it's
Yeah,
nice.
there are
It's
some
nice.
options. I was just looking for.
Okay, thank you for the informative presentation. Thank you. How do students take advantage of these wellness resources, especially during USMLE Step 1 dedicated study time?
Yeah.
All right. So we'll go to how I have hobbies like.
No, we just
Oh,
talked about it at our
sorry.
MD Aware advisory meeting. We last year we actually had a woman come in to do and offered a couple of sessions on relaxation. not that many of our students took advantage of it. So we tell us
Yeah,
what we brainstormed.
When you're
Just talk
studying
about
for step one, you are so focused on that you kind of just like all eyes are on that, and you kind of take care of your own health, like you set your own time. So I don't know that many students participate in a lot of the wellness things during step one, maybe some others, but everybody can sign up for all of the events that we offer. Other clubs are also offering other events, and everybody's always welcome and invited to join. Even if you're studying in step one and you want to join any of these events, you're always welcome to come, and they're always somewhere around in campus, so they're very accessible.
So one of the things that we do is there's a favorite place to study, and we make it only available to the students who are studying for step one and give them priority. So that's one way we try to support them during step one study. And the other thing that we talked about, I don't know, we had talked about it maybe because everyone is, and some people study at home, some people study here, and everyone has different study schedules, so it's hard to do on-campus activities. But we even talked about maybe having online videos available on mindfulness, and we were talking about maybe even just sending out a weekly reminder, and that it's just even, hey, we're thinking about you guys, and here's a video when you have some free, something from Headspace or something like that. So we may try that.
And I think also learning the techniques and be aware.
Reminding people,
you've learned them, you've internalized it, and then when you're studying for step one, you can also just apply them to yourself at that point.
So we've got a little less than, we've got about 7 minutes left, and let's see how many more of these questions we can get through. I have hobbies like woodworking and pottery, and I'd like to continue them because they really help me de-stress. Do you think I'll have time for that in the 3-year MD program? It's not community service or research, so I'm afraid NYU might not encourage that.
No, like you definitely encourage to do things for your own. Not everything has to be done with the purpose of getting into residency. You can do things.
And there is time. You can definitely have time to do other things. You don't have to be engaged. Even in the 3-year pathway program. The 3-year pathway program, the crunch is really, well, you have to do something with the department over the summer between first and second year. So you wouldn't be able to do full-time woodworking or whatever during that summer. But you would definitely have time to do it on the weekends and the evenings. The last 6 months of medical school is tight, and there's probably less opportunity there. But otherwise, again, you set priorities of what's important to you, and you carve out that time. And a lot of ours, we have students who do a variety of things. We have students who still play musical instruments and play in orchestras, and we have students who sing. We have students who train for marathons.
My roommate is currently writing music for an indie video game. Like, people definitely follow passion projects.
Yeah.
Did you mean that pun intended when you carve out time for the wood?
Did you know that?
All right. Next question. I'm here for comedic relief. Physical wellness was mentioned, but what about artistic outlets? Are there any student groups or programs with that sort of focus?
So we are really fortunate to have this Master's Scholars Program in Humanistic Medicine that actually comes out of the Office of Student Affairs, and we offer seminars every semester, 4 to 6 seminars, and where there are opportunities. It looks at the intersection of the humanities and medicine. So there's the I'm trying to
anatomy.
Anatomy
so you go into the anatomy lab to draw.
Writing. There's narrative medicine. There are also dialogues. There are colloquiums, and then there's the Bruton Scholarship Program. So we can talk about that.
Oh yeah, for sure. I also was just going to mention that there's an amazing photography seminar where you could follow a patient with a chronic illness. Maybe it was also neurodegenerative illness, and learn photography skills as well as tell their narrative. So
these are all extracurricular activities, so they're not for credit for the most part, but they're all offered, and a lot of our students, and they're optional, but they're offered every semester.
And student-run clubs also.
And a lot of student-run clubs that focus
on types of dance and art.
Yeah, we have
music and singing and choir.
We have our spin group. We have
and they have a culture show.
Yeah, we have a culture show, acapella, whatever the acapella group is called. Yeah. So there's very talented.
All right, next question is, as a student who took 3 gap years before medical school, I found it's important to ask for help when you are struggling and to lean on your network. How accepting and open would you say the culture is at NYU towards asking for help? Do you feel comfortable speaking to faculty or other students, especially if you are feeling overwhelmed?
I took 2 years before joining medical school, so I'm in that same position. I was in that same position, and I would say yes, they're very open. You can reach out, and nobody's gonna. I've never felt judged when asking or talking to somebody about it.
So I'll just give you a recent example that came up. We had one of the faculty leaders of the early course worked with the student. Actually, the student went to the faculty member because they had a many-year gap years, and they were really concerned about the transition back into medical school. And we actually have peer tutors. We have senior students who we train to be tutors for students who are struggling. Usually, so if a student is struggling, fails an exam, they meet with the module director of that unit, have a conversation, and then we'll offer tutors if they think it's appropriately. But in this situation, the person reached out to me and they didn't even have their first test, but I think the student, it would be great for them to work with a tutor preemptively. And we hooked them up with a tutor and they did great on the first test. So we're definitely, the faculty are very eager to help students. And we do have resources for students who are struggling.
So we've got 2 final questions, and I think we've gotten through every question. So this one is a related topic. Are there any resources geared towards non-traditional students who may have more familial/relationship obligations?
So this is something that I think we've been trying to partner more with our Office of Diversity, and so certainly connecting students who have first generation college students and stuff with other faculty. So we are trying to create more support around that. I feel like this is an area that we're growing in for sure. And I think the students themselves have been trying to, find avenues to support each other. So we don't have programs coming into medical school for those students, but certainly once they're here, we try to hook them up. And again, Diversity Affairs can probably speak to that better.
And that's a great plug, because we've got a webinar in about a little over 2 weeks, October 11th, from the Office of Diversity Affairs. And so at 2 o'clock. So that's a great topic to bring up at that webinar. You good?
Yeah.
All right. And the last question is, my question is for the students specifically. Specifically.
All right.
What advice do you have for new students transitioning to medical school? Great question to go out on.
Go for it. Honestly, my advice is to not listen to advice. This is going to sound ridiculous, but everyone when you get here is going to want to give you advice. Second years are going to give you advice. Faculty are going to give you advice. And that advice oftentimes is a projection of what they wish they had when they entered first year. But everyone's first year is so personalized. What their challenges are, what their strengths are, what they're going through is all about, your life, because you led your own life before you got here, and you continue to lead your own life outside of school. And so I think that one of the challenges for me was getting a lot of advice that just didn't fit necessarily, or thinking that, I'm not doing school right because all the second years said after test 1 or test 2, I'll get my groove and I'll know exactly how to pass, and that wasn't happening yet. So I would say just recognize that people might give you advice, and if it doesn't fit or pertain to what you're going through, that's really common and really normal. And it's really about staying in touch with yourself and what's going on for you. And you're really the best sort of expert of your own experience. That being said, it's so useful to have a community of upperclassmen you can connect with, who you trust, and still receive some of that advice and some of those reality checks. But don't freak out if you're getting a lot of sort of advice that doesn't seem to pertain.
I would say to give yourself the space to be nervous and to find your rhythm and go through that process, because you're going to get all this advice of you guys need to relax, you will be okay, but obviously you have to be nervous first to then be able to understand what your rhythm is and how you study better, and to not be so hard on yourself. You will be hard on yourself, but try not to be so hard on yourself, and just give yourself the space to go through all of that, and go through that anxiety of starting and getting used to it, because beginning something new, no matter what it is hard. And then eventually you'll find your rhythm and what works for you, and that ends up happening for all of us. So it will happen for you. So just, be kind to yourself. I think that would be the.
So wonderful advice. Annie, any additional points of wisdom that
Not a
you'd like to
medical
impart?
student, but I would just say, I mean, yes, follow your intuition, sort of what you're saying, like know thyself, and do the work of learning thyself, and self-compassion is what Camilla is saying. It's like bring it in, it's essential. So.
And Dr. Tewksbury, you want to wrap it up for us?
Yeah, I think very well said by our students, and we're so happy. Thank you both for being here and participating in this. So I think just to wrap up, thank you all for being here and participating. I hope you see how much we at NYU School of Medicine really, really care about our students' wellness, well-being, and how, and I think even more importantly, and how we do that in a partnership with the students and really thinking holistically. This is, it's a complicated issue. And there's so much that goes into wellness and well-being, and we aren't naive enough to think that there's one thing is going to fix it and make it better for everything, and you have to step back and look at everything, and you have to engage the students. So,
well, on that note, thank you all for your time. Thank you, our applicants, for joining us today. And again, remember, we've got the next webinar on October 11th at 2 p.m. Hosted by the Office of Diversity Affairs. In the meantime, if you have any additional questions on the topic, just please shoot us an email. We'll direct it to the Office of Student Affairs and to our students, and we'll get back to you as soon as we can. So I hope everyone has a wonderful day, and hope to hear from you soon. Bye-bye now.